on that today. It's our pleasure to welcome Robert Dozier, Executive Director of the Mississippi Independent Pharmacies Association. Hey, Robert, thanks for coming in.
Good morning, Gerard. How you doing today?
Better when I get this voice working again.
You need to go see a good independent pharmacist.
I probably do, yeah. All right, so let's start with this. Executive order introduced by signing into effect by the president a month or so ago, right?
That's correct. I think it was May the 12th, to be exact, I think. And, you know.
Complicated.
Very, very. Now, this is the prescription drug problem. The high cost of prescription drug problem has been an issue that several presidential administrations have tried to solve, Democrats and Republicans. For many years, we can go all the way back to the first President Bush on this issue right here, and every presidential administration has always had problems with this. And so a lot of people are thinking, well, the current president is just trying to legislate with the pen. And you and I both know that when you start doing executive orders, it gets very complicated, and we also have problems with existing laws that are already on the books. You know, I was reading something this morning, just prepping for this right here, and, you know, this executive order might run, you know, into some issues that we have with the Inflation Reduction Act that was passed in the Biden administration.
How so?
Well, you know, you and I were talking off the air, and the Congressional Research Service, and basically a legal arm of Congress over there, their legal staff, they've put a deal out that was I think it was on June the 5th, apologize, and saying there might be some issues there that President Trump and his administration cannot force some of these drug companies to negotiate to the most favored nation like he intends, because the law says that the government and the drug companies have to negotiate. So we're starting to see some barriers that have been set up already. Now, look, that's all legal interpretation right there. You and I are not going to solve this issue right here today. I wish we could. But, you know, Gerard, the one thing that we're seeing is, as time has gone on over the past, say, 20, 30 years, prescription drug prices have steadily gone up. Now, why is that? You know, the one problem is all of these players that we have in the game right here. And President Trump is correct when he says the United States of America, they're paying more than any country out there in the price of prescription drugs. We're paying probably anywhere between 3 to 5 times more on the brand name drugs than we are and than other countries are. And a lot of people want to point the finger at Big Pharma, you know, the drug manufacturers. Well, I'm not going to sit here and say they are knights in shining armor, because they probably have their problems just like we all do, but they're not the sole problem. You know, you have the pharmacy benefit managers that are out there, the insurance companies that are out there, the healthcare brokers and consultants that are out there that are devising these health insurance plans. So you have a lot of players out there that's just steadily putting another layer of cost on the prescription drugs here in the United States of America.
Yeah.
But I will say this, I am glad that this administration is trying to do something. Now, will this executive order help reduce the cost of the drugs overall? Maybe, maybe not. But it might get to all of the policymakers and all of the players to the table to see what can be done over the next 4 years of this administration.
Well, doesn't the order just request, essentially? It's asking the pharmaceutical companies to lower prices, and if they don't by a certain date, then they're going to negotiate or compel them to somehow.
That's correct, yes. And you start talking about the first 30 days.
Yeah, okay.
Okay, so here we are. What's today? June the 16th. So we're 30 days into this thing right here, and I haven't heard of anything else that the government, the Trump administration has done. So where are we? Where are we moving forward on this right here? But you're 100% correct. You know, the president in his executive order wants to move to a most favored nation policy right here. And he's also talking about in that executive order about allowing the end user, the patient, to maybe bypass everybody and go straight to the manufacturer. That's kind of scary right there.
Well, why do you need an order for that? I mean, so that would like dictate to Big Pharma, you can't have anybody between you and the end user, patient, customer.
That's right. It sounds like the end user, the customer, the patient, would have the ability to go straight to Big Pharma. Well, I'll be honest with you. You know, I'm not going to feel comfortable enough to go straight to Big Pharma to buy my prescription drugs. You've got to have that healthcare provider in the middle somewhere. You know, the pharmacist. Doesn't matter.
Well, I assume you'd still need a prescription.
Correct. Yes, you would definitely have to have a prescription. I mean,
okay.
I would imagine. And you know, for the most part, we're talking brand name drugs right here. I don't think it's really targeting the generic drugs. We're talking the brand name drugs right here. So there are a lot of little issues here with this executive order. Now, granted, we're dealing with Donald Trump here. You know, he's the deal maker, or claims to be the deal maker. So this might be a way for him to try to get all parties at the table and say, all right, guys, we're fixing to do something here.
So my understanding is that in this country, generics are considerably less than in other countries, but it's the name brands that are more.
You're correct. The name brand, the brand name drugs are the ones that are the big problems here in the United States of America. And, you know, you see all of these ads in some papers across the country where you can buy, you know, a brand name drug from Canada, get it shipped to you here a lot cheaper and everything else like that. The president is right. You know, Americans are paying 3 to 5 times more for the brand name drugs. The drug companies, Big Pharma, members, they're the ones that are spending millions and billions researching all of this. They're coming up with the drug. They're manufacturing the drug. The pharmacists are the ones out there taking care of the patients, dispensing this medication, helping the patients across this country. And a lot of the problem is these middlemen, the pharmacy benefit managers, and you and I have had this conversation many, many times before. They're the ones, in most cases, they're driving the cost up. You know, PBMs have always said we're the ones that are helping reduce drug costs. Well, if you look at how the PBM model truly works, they would have to put themselves out of business to really truly reduce drug costs, because the way their model works is they have to keep the price high, because PBMs force the drug companies to pay these large rebates, and it's basically a pay-to-play scheme that's going on out there. And you and I have touched on this a lot of times. You have to get to the root of the problem. I understand what this administration is wanting to do. I just don't know at the end of the day if this executive order is going to accomplish everything that it wants to do. Now, this might be the first stepping stone. Yeah, and then we might look up 6 months from now, toward the end of the year, and the president and his administration might be doing something else. You never can tell with this administration.
So there are analysts in the industry say, Robert, that one of the advantages that the EU has, for example, is that they have socialized medicine. So it's the government is really the only buyer for the most part, and they're negotiating directly with the pharmaceutical companies, whereas in this country you got multiple parties. You got Medicare and Medicaid, of course, a number of commercial insurers, and then just other direct players. So we don't leverage a single source of buying power.
You and I are both free market type guys, and
sure.
You know, we've had this conversation again many times before. But in healthcare, there is no free market in the United States.
That's right.
And you and I have always agreed on that. And
we do.
And we have some friends that might disagree with us on that.
Right.
But in the United States right now, it's not health care, it's health business.
I agree.
And maybe we need to patent that right there and sell T-shirts.
Hang on, we got a break. We'll come back and talk some more. Robert Dozier with Mississippi Independent Pharmacies Association. We're talking to Robert Dozier, Executive Director of Mississippi Independent Pharmacies Association. So, have any of the big pharmaceutical companies, have they obliged with the president's request?
Now, like I was telling you earlier, I was trying to do some research this morning and everything. Not to my knowledge, I haven't been able to find if the big pharma companies have finally sat down with the administration and started this process and everything. I think we're 30 days. We're in 30 days, a little over 30 days, and the executive order says that they have to start doing this process within 30 days. I feel like you're probably going to start seeing lawsuits pop up on this issue right here. Big Pharma is going to probably step up to the plate and file lawsuits. Do I know that? Not with any certainty. That's just a guess right there.
Right.
Because you picked up on a point a while ago. You're talking about Medicaid and Medicare, but then also the administration is maybe looking at doing some of this on the private side as well. Now that gets into a whole nother ball of wax and such. So we're going to probably start seeing maybe some lawsuits between Big Pharma and the federal government, and we might also be seeing some roadblocks like we were talking about earlier with the Inflation Reduction Act law that's out there. I'm sorry, I know you and I both suffer from sinus colds right now, and it's kind of hard to think.
Yeah, so I haven't seen any movement either. Now, I will point this out, and I'm not defending pharmaceutical companies here whatsoever, but from a financial perspective, the top 10, I looked it up, I researched it, they make about $90 billion a year. Google made $120 last year.
Look.
It's a $4.7 trillion industry. It's the largest industry in healthcare in the country. Their profit is way less than 1%. If they made no money, your healthcare costs would change by less than 1%.
It's like we said a while ago. It's not healthcare; it's health business.
I agree.
And you make a very good point for the brand name drug manufacturer. And the issue is this: where's the problem?
That's exactly right. Where's the problem?
Where's the problem at in this scenario right here? Because I'm representing the independent pharmacists of the state of Mississippi, and I know what they're going through right now. You and I've talked about this many times, and everything.
I want to get to that. Yeah.
Okay. And so we're sitting here. I know what my guys are seeing on their bottom line, and it's number one, it's nowhere near Google and or anybody else, but they're in trouble right now, and it is that way across the country for independent pharmacists, especially when you see Walgreens that just got bought out by a private equity firm. Then Rite Aid is over here; they're filing bankruptcy. So where's the problem? Well, all things point to the guys that are in the middle. And the president has also mentioned the pharmacy benefit managers multiple times. He's called them these middlemen.
Monsters, I think.
Exactly. I don't know who they are. I don't know who these middlemen are, but they're the ones making all the money. They are the ones making all the money.
Okay.
And they're not producing anything like the drug companies are. They're not producing a product, and they're not taking care of the patient like the pharmacists in this state are.
So the legislation this past session that would have reformed the PBM industry, tell us about that and why you think it didn't get over the finish line.
All right. So the legislation that we had this past session was it was some good language in there. It added a lot of transparency. It added a lot of things in there that would have helped the independent pharmacists across the state and stuff. And you're seeing a movement of pro-independent pharmacy legislation across the country right now, and basically against the PBMs. It got down to the conference committee, and such, and you get 3 people from both sides, each chamber, and they come up with a conference committee report. There at the last moment, there was some language that was put in there that would actually been going backwards for the independent pharmacists. There was a language in there that would have taken out of the ERISA plans from the steering section right there. And probably if you look at a typical independent pharmacist business, it's their ERISA plans could be anywhere between 50 to 75% of their business, just given any particular business that's out there. So if you took that steering part out of the ERISA plans, it would have really hurt the independent pharmacists right there. And then there was some language that was in there dealing with a severability clause, and that basically the way it was written, it was going to harm the independent pharmacists as well. So it was all kind of a step backwards if it would have gone into effect and such with those two things right there.
What does your organization want to see happen?
What they'd like to see is more transparency in the PBM marketplace. They also want to see fair reimbursements. And NADAC, and you and I have talked about this a lot of times, NADAC is a true and honest and transparent form of reimbursement out there. Now, the PBMs, the insurance companies, the healthcare consultants, they don't want NADAC because the PBMs and the insurance companies can control the pricing mechanism that they have right now. They cannot control NADAC. The healthcare consultants and brokers that are out there selling these plans to these large employer groups, they don't want NADAC either because NADAC gets to a true cost plus methodology. And the reason why these guys don't want it is because they are getting basically paid on both sides if they stay with the old reimbursement methodology there. You've probably seen some of this in the computer software business right here. So whenever you go to a cost plus methodology, you have cost that's out there that's on a website, and everybody can see what the cost is, and then you put a dispensing fee out there, and you know what that is. You have two true numbers. It's real easy. But the PBMs don't want that. And that is a way that you will start seeing drug cost or the overall cost go down, because the Mississippi Division of Medicaid went to a NADAC-based methodology several years ago. Their numbers are savings of $55.5 million annually. Ohio just recently reduced some numbers. They're saving somewhere about $70 million a year as well. And this is happening all over the country in these Medicaid offices. Now, Alabama just went and passed legislation just a few months ago. They are allowing the pharmacies to be reimbursed at NADAC plus a professional dispensing fee. Iowa, they just signed legislation into law last week that would allow the pharmacies to be reimbursed at NADAC plus a professional dispensing fee. So states are moving in that direction. And we have to get to a direction where everybody knows what's going on and that the PBMs are not in control of everything right here.
So when that happens, does that mean the PBMs get less money? Comes out of their pocket?
Well, the PBMs, they have so many different ways of charging the employer groups out there that the employer groups, they don't really know. The PBMs are always constantly saying, well, if we go to a NADAC methodology, it's going to raise prescription drug costs. They haven't been able to show it. And here we are with Mississippi saving money and the Division of Medicaid, and here we are with Ohio just recently releasing a report showing it saves their state money. We have West Virginia out there. They're reimbursing at NADAC plus in a commercial market. The sky hasn't fallen over in West Virginia. So the PBMs, they either need to come to the table with hard numbers and say, hey, NADAC does not work, and this is why it doesn't work, rather than just use these scare tactics.
How do you square that, Robert, with this idea that government is interfering, is instituting price controls by doing that?
Gerard, thank you for asking that question, because it goes back to what you and I were talking earlier, and we've had this discussion multiple times. There is not a free market in healthcare.
Yeah.
And I'm sorry, it just isn't. I'm a free market guy. I'm a capitalist out there. But when the pendulum gets too far to one side, we have to have government kind of bring it back into check.
It's so convoluted.
Oh, it is.
The whole healthcare industry is.
Look, I go back to it's not healthcare; it's health business.
Yeah. Appreciate you coming in, Robert.
Hey, thank you, my friend.
Thank you, man. Yeah, Robert Dozier, Executive Director of the Mississippi Independent Pharmacies Association, coming right back.